You're careful about what you eat and what products you use, and you want the same healthy life for your beloved pets. You've been searching the internet and social media for natural solutions to your pet's issues, and you're trying to find ways to prevent issues from cropping up in the first place. But everywhere you look, you find different answers, varied opinions, and you just end up more confused. Your pet is a part of your family. He deserves the best, and he deserves to live a long, healthy life. I'm here to tell you that it can be easy, that taking care of your pet naturally doesn't have to be a headache for you. I'm going to talk to you about everything natural wellness, including what to feed your pet, how to use herbs and essential oils, massage and hands-on techniques, meditation, communication, and energy healing. If it's natural, it's worth talking about. In this podcast, you'll learn everything you need to know about taking care of your pet naturally, for life. I'm Corine, and this is the Enlightened Animal Podcast. Hello, and welcome to this episode of the Enlightened Animal Podcast. Today, I have the pleasure of speaking to Dr. Edward Bassingthwaight. He is the founder and an innovator of the Whole Energy Body Balance web method and the Healing Vet. Dr. Edward is a veterinary professional of almost 30 years, turned holistic animal care pioneer. With a personal journey through chronic fatigue syndrome leading him to explore holistic healing, Dr. Edward developed the web method to merge healing touch, energy work, and neurofascial techniques, enhancing animal well-being. Not only does he practice this method to bring healing and wellness to animals, he also teaches the web method to a worldwide audience desperate to help their own beloved pets. Welcome to the podcast, Dr. Edward.
Thanks for having me. It's a pleasure to be here.
I'm very excited to talk to you today. So I always love to start each podcast with a story. So I would love to know if you would mind going back and telling us a little bit about what led you down this path and how you got to where you are today.
Well, I started off as a very conservative country boy. When I first graduated, I was just your regular veterinarian and didn't even know what alternative or complementary holistic things were. The first thing that kind of tipped me into the hands-on work in particular was that I was lucky enough to meet a horse vet Dr. Tom Ahern, who developed this method of releasing pain and tension out of horses' necks. And he would get these horses that had a full limb lameness and they couldn't find a reason for it with x-rays and nerve blocks and all those kinds of things. He'd work on the neck and the lameness would go away. So I was fascinated. I hadn't heard anything about anything like this at university. And I immediately thought, well, what about dogs and cats? Because they've got necks and backs too. So I just started looking with my hands, feeling with my hands. And when I started searching more to see what was going on in the bodies of these animals, I very quickly found a whole lot of pain and tension that before I actively decided to look for it, just flew right under my radar. Then I wanted to help these animals, so I just started playing around with touch, with pressure, with movement, because there were no modalities in those days to learn. So right. I just learned by doing, and the animals were my teachers. Fast forward a few years, I came down with chronic fatigue syndrome, and what I didn't know was most likely Lyme disease. I was very, very unwell, couldn't work at all for 2 or 3 years. Western medicine was a little bit helpful in the beginning and then had nothing to offer to help me whatsoever. And that's when I really dug into exploring energy healing and diet and body work and every other kind of holistic thing that I could try out to see if I could get myself well again. Right. Eventually, when I worked out that I probably had Lyme and got on Lyme herbs, that was another big turning point. I started to really get better then. But I think the final key piece of my recovery was getting out of abusive relationships and into healthy format relationships so that my nervous system could relax and be easy and get well.
Right. Yeah, it's pretty amazing how that works, isn't it? That you there's so much learning inside our body and things that we have to release in order to move forward. I completely relate and have been down a similar path, and so fascinating how your personal journey ends up affecting your professional journey as well.
Yeah.
Yeah. And how did you, there's one thing about like the myofascial work and the moving of muscles and fascia, which seems like not a huge jump from traditional veterinary medicine, right? But I feel like you went even, I mean, we'll say it's a midpoint. It's
I
not
think I think it's a bit of a jump in that most of the physical therapies kind of focus on the muscles
right,
or the skeleton.
right,
And the neurofascial, what I call the neurofascial network, because the fascia is everywhere in the body, is this
right,
three-dimensional, structural, interconnecting web on all scales of dimension. And it's very, very heavily innervated. There's so much nervous tissue in it that functionally it's part of the nervous system, and it's very, very important and very
right,
strong sensory organ in the body. So I think that's quite a conceptual leap away from the reductionist view that Western
yeah,
medicine has of
yeah.
reducing to things and symptoms and using drugs or whatever to fix them. So it is a leap and it isn't a leap, I suppose.
Right. But I'm saying, like, visually, I think someone from the outside could go, okay, I could see how a veterinarian could go
Yeah.
down this path. But then I feel like you went a step even further because I feel like you even have gone more into the energy work and almost another step. I don't want to say into the spiritual realm, but
Oh, yeah,
but
absolutely.
but
You
how did you
can.
make that additional step forward? Because that's really another dimension that's even farther from someone like myself who is like you and started from a scientific background. It is, I feel, almost like a quantum leap to get to that next step because you almost have to put your scientific brain on a shelf at a certain point.
Well, yes and no, I'd say to that. But I think the leap was that when I came back to Australia and I was desperately unwell, 45 kilos, lots of pain, lots of symptoms, completely fatigued, couldn't even drive myself to the nearest town, had to get my mum to drive me to town to have body work and things like that. The masseuse that I went to was also a very experienced spiritualist and energy healer. And I found that working with him gave me more relief than anything else. I also came across a beautiful woman in the States who did energy healing. And again, I was looking for stuff and I had my big new age crazy kind of waking up to all sorts of weird and wonderful things. But, there'd been an element of that as a child of seeing some ghosts and things like that. So it wasn't like that intuitive perception was always there in my system, but then it just came to bringing it out. Then I went and
Right.
studied energy healing and got invited to join a circle where for a couple of years, one night a week, we'd do channeling and earth healing and all sorts of weird and wonderful stuff in the more spiritualist realm of things. So I had a really interesting apprenticeship. And interestingly, there's actually some pretty fine research showing that the spiritual energy healing interventions can definitely be doing something greater than a placebo. And we have some double-blinded placebo, randomized studies that have been replicated and show that something is going on here.
Right, right.
So,
And I think it's definitely a good direction that we're going in. Continue. Yeah. Yeah.
yeah, well, the thing is that science has trouble with it because science can't see a mechanism of action. So it
Yeah.
gets a headache and wants to lie down or gets up a big stick and chases everyone saying this is woo-woo nonsense. But when you actually start doing some research and treating it as science should, which is to have an open mind and explore the possibility of phenomena, then I see it as a science. I don't see it as in being conflict with the scientific mind view at all.
Yeah. And I am in complete agreement with you, but it is true that sometimes it's like, well, if you can't prove it and they can't see it, then they don't believe it. And it's kind of making that leap. And I think it's wonderful to see more and more professionals from the scientific realm like yourself who are starting to move in that direction. Now, you are one of the pioneers. You've been doing this for a while, but we're starting to see it more and more. And I think it's wonderful shift, universal shift that finally it's like the rest of the world is catching up to you, right?
Well, absolutely. And, I believe that when we're talking about energy work and intuitive perception at a distance, what we're really doing is the quantum entanglement of consciousness. Now, we can't prove that as of yet. We don't have the sensory kind of scientific equipment to be able to measure such things. But you look at Rupert Sheldrake's research with dogs that know when their owners are coming home, and certainly my personal experience as a practitioner, where I had bought a collie dog I was working with a little while ago, moving from energy center to energy center, and we were seeing major physical responses when I'm shifting the focus of attention in the energy system from one place to another.
Right.
And the owner's going, look at that. This is crazy. So the animals can feel and sense and be affected by energy in a whole range of ways, just as we are. I mean, if you walk into a room with two people and they've just had a big fight and they're sitting there pretending that everything is okay, you get a sense, right?
Oh yeah, you can feel that energy. Yeah, yeah. And I think that animals are they're so much more sensitive and intuitive than we are that, I think a lot of times they're our greatest teachers, aren't they? If we just watch them. Yeah. I think we're the ones that need the teaching, not the other way around. Yeah.
Well, I think we're born with open sensitivity empathically and intuitively, and we shut it down because of social pressures and because of the immense trauma in the human race. To connect with that can be so overwhelmingly uncomfortable and painful for a little infant. They just go, oh, I can't feel that. It's too much.
Yeah, definitely. Yeah. I think, we're all open and then it gets shut down. And then some of us have it reemerge earlier than others. And it's a beautiful thing when we finally it's like a full circle kind of coming back home. So that's wonderful. And can you talk to me a little bit more about your system, your whole energy body balance system, and exactly what it is for our audience who might not know, and how it can help in their lives with their pets?
So the whole energy body balance method has probably got three kind of pillars. One is somatic awareness of the practitioner, so coming into your body, being present and connecting to the natural energy flows so that you're filling your energy cup, if you want to think of that, your vital life force, to overflowing natural healing energy to the animals as we're interacting with them. Then we have the bodywork side of things, which is therapeutic touch, but that touch is informed by that hands-on kind of energy flow of vital life force from the practitioner to the animal. In the bodywork, one of the key things is learning how to feel into the body, to discover silent neurofascial soft tissue, neck and back pain. There's a kind of a fairly comprehensive assessment process that goes on there so that you can map out what's going on and unearth anything that might be hidden. And then there's a whole range of different skills, ranging from very gentle, relaxing, craniosacral, relaxing touch, which also help animals with anxiety and trauma very, very much, right through to really deep work where you're getting into the core structures and tissues and getting into mobilizing and relieving pain and tension out of deep in the body.
Right.
Then we have the web energy work side of things, which is about reopening that intuitive empathic awareness and working with the energy centers, the energy fields of the being. Now, I tend to use them together. I think they're much better together. And there's also a very strong component of relationship. I think probably the most important thing about the whole energy body balance work is that everything we do, the relationship with the animal and communication and listening to the animal and responding to the animal at the heart of everything that unfolds between the humans and the animals as we're working with them. So with touch, you hit a sore spot, the animal goes, oh, it's a bit much. You instantly relax and then reconnect more gently until you get to a spot where the animal can go, well, yeah, that's a bit sore, but I can stay with you. And likewise with the energy work and just talking dog and talking cat, learning how to express healthy boundaries with dogs, which 95% of humans are diabolically awful at expressing healthy boundaries with their pets. If that's a problem mentally and emotionally for the pets, it leads to distress. And when you can be a benevolent leader and show up in a kind way around personal space and around being able to say a healthy yes to your pets that they might not like and a healthy no that they might not like, and being strong enough emotionally to just do that no matter how much they carry on and look at you with sad puppy dog eyes. It's a really comprehensive system that brings a whole lot of stuff together. And we've also working with horses. We taught this work for horses for the first time this year. And we have a
Wow.
program for people who want to work with humans too.
Yeah, I mean, I was thinking about that because it's so comprehensive. It sounds like it's almost as healing for the human side of the team than it is for the animal side as well. That there's this whole shift in the relationship in essence, almost like people come for pain relief or an issue, physical issue in their animal, but they come out the other side with so much more.
Yeah. Well, the other thing is, as soon as you start working with an animal, whether it be with the touch work or the more intuitive type of work, as soon as the animal starts shifting, then the humans who are connected, there is a sympathetic kind of response in the humans, which if I'm in the room with clients, there's like this co-regulation matrix of energy and consciousness that all of us in the room might go at the same instant, or we'll all yawn, the
Right.
animals stretch and the humans will wriggle. So there's this very strong energetic, physiological co-regulation that happens.
Wow, that's amazing. And so is this something like, do you still do this yourself in private practice, or have you
Yeah,
focused or have you switched more to teaching it, or is it kind of half and half?
I do both.
Okay.
We teach, which is a big part of what we do, but I have a practice of working one-on-one with people. I do home visits near Taradale
Mhm.
here where I live in Victoria. I have some people drive in who are outside my home visit zone for one-to-one in-person appointments. And I work with people on Zoom all over the planet, helping them with mentoring and the intuitive approach, holistic veterinary services, all those kinds of things.
Okay. Okay. Wow. That's fascinating. And is that your main focus now? I mean, even when in your private practice, or do you still do more? Have you moved completely away from more traditional veterinary work?
Well, I call myself an intuitive integrative veterinarian these days. And one of the things that I believe really strongly is that if you want to call yourself a holistic practitioner, you've got to be aware of and consider all the options,
Right.
allopathic and naturopathic. Now, I don't go to the allopathic prescription type medicines or surgery as my first port of call, like as some vets do, because that's what they've been taught how to do. But if I think I'm going to get the best outcomes for an animal, perhaps I've got an anxious animal and we've tried CBD, or that animal is anxious enough to be a danger to themselves and to others, then I might say, well, yeah, I absolutely think we should consider some prescription
Okay.
um, anxiety medication so that we can at least put a lid on things while we're getting everything else into place and doing all the other behavior modification and so on and so forth. So
Right.
I have to kind of argue this with some of my clients because a lot of them are very passionate about holistic, alternative, complementary stuff, and they're totally anti anything to do with any kind of prescription medication. Now, most of the time I'm right there with them, but sometimes it's like, well, you know what? I think we need to talk about this. Or if you've got an animal with a raging infected hotspot, well, they're going to need antibiotics. It's just
Right.
common sense. So
Right. Right.
mostly my practice is really holistic, complementary, alternative things, but I'm always open to the fact that if I'm going to do whatever gives the best outcome in the
Right.
end.
And I think that's a beautiful way of looking at it as well, because there is, I think there is a place, whoops, I think there is a place for traditional medicine, like you said, in certain instances, emergency situations. Yeah, I do find it's a beautiful way, what you're doing to kind of marry the I guess what you could call traditional side of medicine with this more holistic side, and in looking at the patient truly holistically and saying what would be the best in this instance. And I understand, it is true. So many people, I mean, myself included, it's like, if you can do it naturally, why not? But sometimes you need those, medications, or that surgery,
Yeah.
or that intervention that you can't find in a holistic, way. There's just no alternative. And I think it's a good mindset to kind of sit on the fence and be able to use everything at your disposal, instead of just throwing one part away completely and going, no,
Yeah.
I don't want to. Yeah.
And with with the other thing with all my clients, I want to get my people to the point where they can make a really good informed choice that they'll be happy with no matter what the outcome is, that they're confident they've done the best thing that they can do in this situation and these circumstances.
Right. Yeah. And that's beautiful. That is a beautiful thing. And kind of going back to your, your web training, is it more for people who want to be practitioners? And then do you have like a bunch of practitioners out there that are helping people? Or do you find that pet parents who don't really have, a knowledge of integrative medicine or whatever can get benefit out of it as well, just for their own pets if they wanted to do this?
Yeah, absolutely. We have a practitioner stream, a professional stream, and we have a home stream. So people
Okay,
who want to help their own animals at home.
that's
You don't
wonderful.
need
Yeah.
to have any prior learning or knowledge of anatomy or physiology or anything like that. You just come along and we get you with your hands on your pets or moving energy with your pets and making a difference. It's it's not rocket science, but neither is riding a bicycle. But if you get on a bicycle for the first time at 50, you might fall off a few times before you can ride along the road.
That's true.
So we
Yeah,
just show and demonstrate, and you do what we show you, and very quickly you start connecting with your pets and making a difference for them. Or
that.
becoming a professional practitioner. We've got about 50 people around the world who are certified in practicing.
Oh, that's wonderful. That's wonderful to hear. And I know something else that you're really passionate about and you talk about a lot is silent pain in pets. And I think it's something that a lot of people don't realize because most people can't talk to animals and ask them directly. Can you talk a little bit about that in more depth? Because I know that is something that you are passionate about, is getting people to understand that.
Well, what I call silent pain is soft tissue or neck and back pain that is affecting animals, but that they show very small amounts of signs or no signs at all of. And the only way that you can consistently or accurately find it is to feel into the body, and then when you hit a sore spot, the animal goes, oh, yep, I'll show you where it hurts and how much it hurts. Now, my experience is that at least 50% of the animals that I see for the first time have got significant pain that is a mystery to the humans, that the humans don't know is there.
So that's a high number, yeah.
Well, it is, and vets aren't. I didn't get taught anything about this kind of pain at university, and vets are still not generally being taught anything about it or how to find it. And it doesn't show up on x-rays or CTs or MRI scans because soft tissue, it builds up everywhere in the matrix of the connective nervous tissue throughout the body. So your vet's going to look at the x-ray and go, well, there's nothing to see. And I know it's not that they're bad vets and I'm not blaming them for it. It's just there's an across-the-board knowledge and skill gap when it comes to this kind of pain and suffering in animals that I'm on a crusade to fill. That's why I've created the course, and I've written a book which will be launching in the next month or two as well about silent pain in vets.
That's
And
exciting.
the whole thing is to educate people as to what it is and why they're probably missing it in their pets,
Yeah, no, and it's almost, it kind of reminds me, it's, for a different cause, but it kind of reminds me of kind of fibromyalgia in humans. And it's
Yeah.
kind of the same thing of, going, I'm in pain. Unfortunately, our dogs and cats can't tell us that, but it's kind of the same thing going, no, I'm in pain, but no one can see it. And so there's no way to diagnose it. And we have the luxury of being able to say it out loud. And even in the human realm, I mean, fibromyalgia is very difficult to treat. So, you have that
Yep, I
extra
know.
difficulty in animals because we don't have that speech for them to say, this is where it hurts. This is what I'm feeling.
Yeah, look, absolutely. And, I lived with that kind of chronic fatigue, fibromyalgia pain for a long time. So, and people would look at me and go, what's wrong with you? You look fine. And quite apart from fibromyalgia chronic fatigue, there's a lot of humans who are living with soft tissue pain or neck and back pain that is often poorly treated or not treated at all, and people just put up with it.
Yeah. Yeah, it's definitely something that needs to change in all species, human and animal alike, and because no one should be living with chronic
Oh,
pain or silent pain, and just kind of, dealing with it. It's definitely not things. So I think it is a wonderful thing. What's the name of your book? You talked about a book coming out. Do you have a name, have a title yet?
it's the full title of it. Let me just see if I can find it. Here it is. Give me 1 second. Find and heal your pet's silent pain. Learn to hear your pet's silent cries for help. Never miss hidden pain, anxiety, and trauma again.
Wow. And so coming out in a couple months, you said?
Yeah, we're in the final stages of getting everything in place. We're hoping to launch around about 1st of July if all goes well, but you never know with these kind of projects just how well
Yeah.
things will go.
Yeah. No, that's exciting. This is your first book, correct?
It is, yeah.
Oh, that was very exciting. Well, congratulations. I'll have to keep my eyes open for that when it comes out. So I have to get my hands on that book.
Yeah.
Can you kind of talk a little bit about, for pet parents, what you consider to be kind of a holistic approach to health and longevity, and how if someone is looking at, like, I want to do better by my pet, and how can they kind of go about that, keep them alive longer and healthy?
I think the number one thing is a healthy, fresh, whole foods diet. I feed my dogs a bath, biologically appropriate raw food diet. I just do the pre-packaged, pre-frozen commercial ones. Some people make up these plates with 25 ingredients that they rotate every week or every day. I just don't have the capacity to do that. I really admire the people that do have the time and energy to do that. Home cooked is fine too. It's just got to be fresh, living, whole food ingredients. A total avoidance of processed food, kibbles and things like that, though I do understand, I'm sensitive to the fact that that's all that some people can afford, but if you add a bit of veggies or a little bit of meat or a raw egg now and then, it does increase the quality of that dramatically. Minimum vaccination for maximum protection. So teeter test, always teeter test before revaccinating, because your core vaccines, your C3, parvo, canine hepatitis, distemper, modified live vaccines that all vets use these days give a long-lasting duration of immunity of at least 5 to 7 years, often lifelong. Maybe not often, but often a lot longer than 7 years. So vaccines, while they're highly effective at preventing disease, are not without risk, up to and including death in rare cases. So I'm red hot on teeter testing and never, ever revaccinating without teeter testing. So we have diet, we have minimising vaccination, a happy, relaxed, stress-free, trauma-free household. So the humans have to do their work on this front in terms of making sure that they're actively dealing with any anxiety or trauma in their life. Proactive healthcare, making sure dental health is good. So raw meaty bones are a big part of that for our carnivorous pets. And really making sure that you have an ongoing, proactive, continuing assessment, regular checkups, staying ahead of the curve, learning how to get your hands on your pets in it with therapeutic touch. And there's a range, of course, of supplements and things that you can use, medicinal mushrooms and CBD and all sorts of other things to kind of maximize health and well-being. But in a nutshell, it's kind of food, diet, environment, toxin-free environment too, so getting rid of all your artificial fragrances, minimizing exposure to EMFs and all that sort of stuff too.
Yeah. I know that's a good program. It's funny that you were talking about vaccines. I mean, not funny, haha, but not funny, not in a great way. It's actually vaccines that started me on this path of my 4-year-old went in, I did like most pet parents, and you get your vaccines every year because that's what the vets tell you to do. And she, at 4 years old, got lymphoma 2 weeks after her recall vaccine. So, and at 4 years old, which is unheard of. And that's actually, it is vaccines specifically that took me down the path of holistic healing and completely changing how I take care of my pets. And it's funny how sometimes, it takes a dramatic event to wake you up.
Yeah. And, some people use homeopathic disease protection. and that's a valid thing, but we just don't have data to tell us exactly how effective it is, which
Right.
makes it a little bit harder as a professional to talk about it. But
Right.
I know people that go down that route, and that's if you've totally had or if you've had an animal that's had a vaccination reaction, and it's probably really risky to revaccinate because the risk of reactions increases with every vaccination. And if you have one reaction, it's likely to get worse the next time. Then I'd strongly recommend you talk to a homeopath about
Yeah.
that kind of thing, because I've used that to help unwind vaccinosis too.
Right.
Homeopathy can be quite effective for that.
Right, right. And I mean, I take the I'm curious if you agree, and I think you do, is after this situation, for all my future dogs, this happened a while ago, I just did the research and did notice how long vaccines actually are valid for, and understood the reasoning behind the vaccination every year is because people don't want to go in and pay a vet just to look at their dog and go, oh, everything looks good. And so it was almost like the reasoning at the way back when was like, well, if we tell them that they need to get vaccinated to keep their dogs healthy, then they'll come
Well,
in and do these health checks, right?
I got to tell you, the reasoning is bottom line, I think, for that one. I know that some years ago when I was in Townsville, it must be 15 years ago, when I realised the whole thing about vaccination and looked at the research, which shows very clearly how long the duration of immunity is. And I changed and stopped revaccinating every year. I lost about 20-30% of my income in my practice.
Wow.
So
Yeah.
it's a big financial thing, but it does make my blood boil, because, the veterinary surgeons, boards and associations and everyone say, you must have an evidence base, you weirdo woo-woo people, but they are ignoring the evidence base when it comes to vaccination. And,
Yeah.
it's kind of like a double standard,
Yeah,
which
that's
gets,
true, because there is definite research that shows
oh
the,
yeah,
the longevity. And it's like us. I mean, it's almost common sense. We don't go in every year and get vaccinated. Why would our animals be any different than us,
well,
right?
no, people do go in for a flu vaccine every year. You got to remember
That's
that.
true. But I'm thinking at least for the core vaccines, like when we were
Yeah.
children, you have your vaccines and then you're covered, right, for the majority of your life. And we live a lot longer than animals do. So,
But
or
to
at
be
least
fair,
dogs.
there is an element of professional risk that if a vet says, you've got vaccines that are registered for yearly or 3-yearly administration,
Mm.
and they then say not to do that. If an animal did get sick, there could be professional risk. So I do understand some of the other
That's true.
side, but I honestly believe if you get the teeter tests, and any vet can get the VaxiCheck kits in-house that are very affordable, if you've got adequate antibody levels, then a vaccination is not doing anything at all except an opportunity for harm, because the
Right.
antibodies grab it before the body can respond to it.
Right, right. Yeah, well, when I changed, I switched to I vaccinate my dogs, or did, because they're all old now, but when they were puppies, I got their puppy vaccines series, and then that's it. And I've just done the testing since then. And my eldest, who just passed away a month and a half ago, died at almost 15 and never had another vaccine. She never had to. So I have living proof from doing the testing that, I mean, at least for her, and my other ones are, the youngest is 9 and the eldest is 13, and they've never had to be vaccinated again. So I'm looking at
Yeah.
dogs that are 14, 15 years on and still with antibodies. So it's almost like a living experiment with my dogs.
Well, it is. And
Yeah.
the profession should move in that direction, but there's a lot of big money
Yeah.
kind of in the way.
Yeah, that is unfortunate that, money ends up, and I understand, you have to make a living also, but it is unfortunate that the best way for vets to make money is to have people coming in yearly for vaccines. And so it's kind of a double-edged
Well,
sword because,
it's one way, but I believe the
yeah,
profession can actually talk about how to do things without doing that.
yeah,
Yearly health checks is absolutely really important, and I'd encourage
yeah,
everyone who's listening to make sure you do take your animals in every year, even if you're not revaccinating, because your vet might find a little tiny lump that, if they catch it, then is just a simple little operation and cure, and the cancer's gone. But if you leave it 2 or 3 years and it's in a spot where you don't touch your animal so much and you miss it, you might then have a really advanced problem that is not a good news for anyone.
Yeah, that's great advice, I think. And I think more people need to do that and find a different way to interact with their veterinarians in more of a preventative capacity, which is really nice to hear. And then use the holistic side for maintenance. And then, yeah. So wonderful. Well, thank you. That's, I think, a really wonderful way to wrap up our conversation. Do you have any last thoughts or something that you would like to pass on to the audience before we end our conversation today?
I think the thing that I love most in my work is the loving touch, therapeutic touch. And not only does it help you find and relieve pain and tension in your animals' bodies, it helps you build a deeper relationship. It helps ease anxiety. It helps heal trauma. It's just, I went to see a poodle yesterday, and at the beginning he was like, "Oh, I don't know about you touching my sorbets. I don't know about you. Oh, this is a bit weird. You've never been taught how to pat a dog properly. You need to go back to dog patting school." But then at the end, when I sat down with my cutie, he got up on the couch and he snuggled right in beside me. And that's what I love.
Yeah, that's beautiful. That's beautiful. And I think it's probably just as healing for the human as it is for the pet too, to deepen their bond and the relationship. Yeah. So wonderful.
Absolutely.
Wonderful way to end the conversation. Now, I have one more question for you that I ask every single one of my guests. I have my method of working is called soul-led dog parenting, which combines mind, body, and spirit into this beautiful, holistic way of parenting your dog. And I would love to hear your thoughts or how your work integrates into soul-led dog parenting.
Well, I think I'm doing pretty much exactly the same thing, just different kinds of skills that are expressing the same intention. I want my dogs to feel like I listen to them and like they can trust me and like they are part of the family, and they are definitely incredibly sensitive, intuitive beings. If I'm not feeling well, they'll come and check me out and help me out. So yeah, I think there's a very great deep similarity in our intentions. It's just that, the different types of things we do might be different, but the underlying intention is very much the same.
Wonderful. I totally agree. And so thank you for this conversation. And if people want to find you, find out more about you, work with you, learn from you, where can they find you online?
If they go to www.thehealingvet.com, if you want to do sessions with me, Zoom sessions, or see me in person, you can connect with me there. And wholeenergybodybalance.com is where all the information about the modality and trainings and so on.
Wonderful. And are you on socials as well, or not so much?
Yeah, we've got, if you search for The Healing Vet on Facebook, that's probably the place we're most active, but also have a YouTube channel, which we have things going up, little live videos pretty regularly.
Wonderful. Well, I'll put all that information in the show notes in case anybody didn't catch that, so they can go and connect with you. Well, thank you so much, Dr. Edward, for spending this time with me. It was a wonderful conversation and hopefully very enlightening for our audience, in that they learned a whole bunch today. So thank you so much for spending this time with us today.
You're welcome. Thank you.
Thank you. And you have a lovely day. And so that is the end of our podcast for today. Catch you on the next episode. Bye-bye.
Thank you for listening to this podcast. If you're the kind of person who likes to help others, then share this with your friends and family who have pets. If you have found value, they will too. If you have questions, I'm here to help. Email me questions at contact@enlightenedanimal.com, and I may use your question for a future podcast episode. If you want more, check out my website at www.enlightenedanimal.com. Finally, I have a personal request. Please leave a review wherever you're listening to this podcast, ideally a positive one, so we can reach more people and help more animals' lives. Thanks for listening.